Northeast public health officials are taking the first steps towards what it is hoped will become a full, locally run test and trace service. Health experts and political leaders in the region have spent months calling for far greater local control over the service, believing that local contact tracing efforts are likely to have much greater success in identifying COVID-19 cases and preventing outbreaks than the much-criticized national. Northumberland County Council commenced a local contact tracing scheme last week, and a similar Newcastle project, run by the City Council and Newcastle Hospitals Trust, began work yesterday, Thursday, February. The Newcastle service will initially be tasked with finding people who have come into contact with an infected person but have not been successfully traced by national test and trace within 32 hours. But it is hoped that local officials will soon be given the authority to investigate every infection and begin tracing contacts immediately, instead of having to wait for the national system to try. For public health bosses believe that having contact tracers who can call people from a local number and who possess local knowledge will make it far easier to track down cases, as well as point people in the direction of any support they might need while self-isolate. North Tyneside Council has also announced that it has recruited a team of 5 contact tracers, and Newcastle Public Health Director Eugene Milne says that all Northeast authorities are expected to do the same. Professor Milne said the move was a first step to bring pretty well the whole of the test and trace approach down to a local level so we can optimize. He added, "What we have tried to do with test and trace is get people who know the local area and know local communities, know the situation for the people there. We want to be calling people from local numbers so people don't see some strange national number coming up on their phone. We are looking to use text messages to tell people that this is the public health department from the City Council trying to get in touch, because we know people are more likely to respond to that type of local we want to put people directly in contact with the welfare and well-being support that's necessary for them, so they don't have to seek that out if they are asked to self-isolate, and also to look at ways at which we can help people to be supported while they are self-isolating. While we are doing this, we want to link it together with other services so that we can encourage people to get tested and maximize the impact of those measures in controlling the spread of COVID as we can get out of lockdown." The Newcastle local test and trace team is being run through the integrated COVID hub Northeast, which is also responsible for a new innovation lab developing new ways of COVID-19 testing in the soon-to-open Lighthouse Laboratory testing facility. Martin Wilson, Managing Director of the Integrated COVID Hub Northeast, said, "Working as an integrated COVID hub is bringing huge benefits for the Northeast. Importantly, our collaborative approach has really strengthened the coordination of expertise and resources across the NHS, universities and local council teams." For Newcastle's local tracing pilot, through the COVID hub we have been able to allocate new resources, including people and technology, to reach some of the more vulnerable people affected. This approach brings together local knowledge and data, allowing our team to focus the right support where it's needed most.